something wellness. Then she's got your message. You came to get it from Karla's Korner. Make the world better, one life at a time. On Karla's Korner.
Hey everybody, it's Karla Jarvis, your favorite nurse practitioner, coming live from Karla's Korner. Yay! I am so excited to have one of my favorite docs in the whole wide world, Dr. Kenneth Karla, cardiologist, who has now joined with Jarvis Family Medical Services, so we can give you all more of a community-based primary care service, right? And he has so much knowledge, and that's why I love him. So tell us, what made you go into cardiology?
Originally, I was going to go into pediatrics because I loved little kids.
Me too.
And I love my pediatrician. But then when I went into pediatrics, it was not challenging enough. Most of the treatment was, ear infections, strep throat, etc. And when I did my rotations in cardiology, it was exciting because there were so many things you can do. You can do heart caths, you can do echocardiograms, you can do stress tests. It was just, there were more procedures, there was more, you were more involved with the patients, and we had a very good instructor. Sometimes the instructor you have, the physician that teaches you, will, decide for you, or help you decide what exactly you want to do.
Yeah, I do a lot.
That's a big difference.
It sure does, because we do a lot of nurse practitioner students here,
Right.
and I kind of help them because I can kind of see their strengths and their weaknesses,
Right.
or where they're like flourish, because we want them to flourish
Right.
out there in the healthcare field. So I have on red today because we know February is all about Heart Month, but every day is all about hearts. We have unfortunately lost our office manager, Erica Alexander, to a cardiac arrest. She had a long-standing history of hypertension, and then finally her heart just could not take it anymore. And we sorely miss her in the office. And that really woke me up to the importance of really teaching you. I mean, I tell you and I teach you, but it was like, okay, I need to bring somebody else to reiterate what we're talking about when it comes to the heart. The heart is like, besides the kidneys, like one of the most important organs in the body. And when we take care of you, we have a very diverse clientele. We have Caucasian, we have African American, we have Latino, we have Island Pacific, we have Indian. We have a lot of different people here. And so we know we're not a cookie cutter office. We treat the patient as an individual. So one thing we talk about first and foremost, and we'll have this conversation about, is hypertension. Tell the people what you told me, because it's so interesting.
Well, African Americans are treated differently for hypertension compared to Caucasians. And often with an African American, it's recommended that they be started on a diuretic, a water pill, to get rid of salt and fluid in the body. That's the first mode of treatment. In Caucasians, you can start with a beta blocker. It's a medication that slows the heart rate down, brings the pressure down, or a vasodilator, which dilates the arteries, and there's several of those available. And the reason for this is that it goes way back to the slave trade.
Yes, you all listen to this, because it's about genetics and how we were brought to this country. And this is what a lot of doctors don't want to get into and tell you. And that's why we have a lot of biases in healthcare. So we don't have that here. We get to the nitty gritty and we tell the truth, because slavery was real. We're not going to sugarcoat it, but tell them why in African Americans the water pill is so important.
Well, when they would take the slaves, they would put them on these boats and literally chain them just side by side by side, multiple decks. And they would go from Africa through the Caribbean to either Cuba or some of the other, then eventually was up to the eastern coast of the United States, the south. And it was hot in these boats. I mean, they were not given the slaves water, and they would lose one a day or more than that. And the attrition rate was very high. And then when they got here, where did they work? They worked in the fields, or the cotton fields, the southern fields, where again it was hot, and many of them passed away there. So the people that survived genetically, their genes modified, as all of ours do, and they became salt retainers, and they had to, because they're out in the heat, and they didn't want to dehydrate, so the body made them retain salt. So that's why people that have had that gene passed down to them over the years retain more salt. So the initial treatment for an African American patient would be to start them on a diuretic or a water pill to get rid of the excess water, salt restrictions in food, and putting salt on your food, and that would be the first method of treatment.
Right. And so I know some people, like I know people in my own family, oh, I don't want to take it today, or I don't want to go to the bathroom all day. Yes, you do, because we want to reduce that fluid around the heart and in the body so that heart is not overacting, have to overwork, which then eventually will wear it out. Mm-hmm. And then that's the reason why we work so well together, because I do genetic testing, right? So we find out what medicines are appropriate for them. We don't want to just give you a diuretic and say, here you go, and your body don't process it, because that's going to cause more harm than good. So that's number one we do. We also find out what foods you all process so that we can tell you, okay, these foods are causing you more inflammation in the body, which is you're not getting rid of it by, oral or by defecation, which is going to the bathroom. It's just staying in the body causing a whole bunch of inflammation. Mm-hmm. And nobody want to walk around with no big old gut. That's not sexy, people. And nobody want to walk around with your heart not pumping correctly, because that's not sexy. You can't breathe. You can't walk up and down the stairs. You get fatigued very easily. You can't spend time with your family or your loved one. So nobody is ever looking at you, because sometimes we do know as African Americans, we get the short end of the stick. We're quicker to die from diseases because of the biases in healthcare, and because people don't look at the genetics and have them come back. I'm a strong believer in the patient coming back 4 weeks. If I put them on new blood pressure medicine, they come back in 2 weeks. Right. I need to know if it's really high, they're coming back in 1 week. Mm-hmm. I'm not going to write you a script for 6 months to a year out and say, see you later, and not checking on you. Do you believe the same thing?
Absolutely, yes.
Yeah. And I loved how when you joined up with us, you brought in a 12-lead EKG, you brought in a 2-lead echo. What's the difference in the two devices that you use, the diagnostic tools?
Well, an EKG is basically an electrical measurement of the rhythm of the heart. Mm-hmm. You can tell if the patient's in a normal rhythm or an irregular rhythm. You can tell if they're having skip beats, regular premature beats. You can also see if the patient is having abnormalities in the baseline, whether they have a strain on the heart. The echocardiogram is actually a sonogram, like they would do to check a fetus. It's the exact same machine, only they have a different probe that you put on the chest, and you can see the heart actually contracting. That allows you to see the wall thickness of the heart. People with hypertension a lot of times have left ventricular hypertrophy, or the wall between the chamber is enlarged. Mm-hmm. They can have what's called diastolic dysfunction, where the heart contracts normally, but the relaxation is stiff. Mm-hmm. And then we can also, besides checking the systolic and diastolic function, the pumping of the heart and relaxation of the heart, we can check the valves. You can see each valve opening and closing, and we use what's called a color Doppler, and we measure color flow across the valves. And if a valve is leaking, you'll see a certain color going across it that shouldn't be going across it if the valve was not leaking. Or if the valve is stiff, it's the same thing. You'll get a measurement to see if the valve is not letting the blood through. So it gives us a tremendous amount of information. It's visual. I've often liked to show it to the patients, because they get to actually look at their heart and the valves, and you can explain exactly what their condition is. And
it's funny that you say that, because you came here and we are so forward thinking in healthcare, and we are so excited because we got you some smart boards. And those smart boards that's going in your office are actual 3D visuals, aids to teach the patient where they can actually see the heart and they can see the different chambers. Because I know in primary care, when I talk to them and say, okay, you can't do this, you need to do this and this, that's different than actually giving them something or letting them see the results and then really understanding it, going home and digesting it. People will do better if they know better and if they have more hands-on with it. So with you doing that, which I don't know of a lot of cardiologists in Louisville that's doing that, that's like forward thinking right there.
Oh, yeah.
Because you can show them exactly what their heart looks like.
Right. Yeah, a picture's worth 1,000 words. I mean,
yes.
Some doctors will just come in and say, oh, you have this, this, and this, and your valve's not working, and out the door they go.
And they don't understand nothing what they're doing.
The biggest complaint about patients about doctors is that they don't spend enough time with them. They don't talk to them, they don't explain things, they don't listen to them. The average amount of time before a doctor interrupts a patient while they're talking is about 13 seconds.
Wow.
One thing I always try to do, I mean, some doctors will have a model of the heart and explain things. Sometimes I'll draw things out for them. But when I've done my echoes, I've brought it into the room and actually say, okay, this is your valve, this is the one that's leaking. And when they actually get a visualization of what's going on, and that's what those boards will help do, it's so much different. You really understand what you're being treated for, what's happening, and I think that's going to be tremendous.
Now, what I want to talk about too is we're talking about heart health. So everybody thinks that they got, because it's February. Oh, let me go get this gym membership. And I'm like, okay, you're gonna go one time and just spend that money and not go back again. But they can do different things. Don't you talk about, like, they can do some dancing, they can do Zumba, they can walk, they can play a Wii. Is the Wii still around? I don't even know. My kids love the Wii. But they can do things that's considered exercising, because all it is really doing an activity to get your heart rate up, right?
Right. Yeah, you can do anything. I mean, just people that walk 2 miles a day, 3 or 4 days a week. Actually, there's studies showing that they live 2 years longer than people that are inactive.
Wow.
And you're absolutely right. It doesn't matter what exercise you do, whether you walk on a treadmill, whether you go out and walk and listen to the birds and watch the squirrels, whether you do the elliptical. You really don't have to go to a gym, but sometimes that motivates people before or after work to actually stop and do the exercise, rather than, oh, when I get home I'll do it, and then you get home and you're tired and you find all kinds of reasons not to. But it's not a specific type of exercise that's going to be better than another. The main thing, if you want to have aerobic exercise, it's to exercise to get your heart rate up to a specific level for your age, and maintain it exercise for about 20 to 30 minutes, a minimum of 3 times a week. So if you do a power walk or a jog or whatever, and you maintain it for at least 20 minutes, and you do that 3 or 4 times a week, that's aerobic exercise. That'll help your heart. It'll build up the heart strength. It'll help you lose weight. What you don't want to do is a rapid walk, like a jog or a sprint, and then stop, and then walk and stop. A lot of times, I would tell the patients after they had bypass surgery, the weather is crummy outside, they don't have a gym membership, that we'd send them to the malls.
That's what I was just about to say. Yeah. I love to see them power walk around the malls.
Yeah, they walk around the malls. So there's no rain. You can go in there, and we actually had it mapped out at one time where as you walk around each of the malls, it would show this is a mile, this is a mile and a quarter. But I always told the patients, you have to walk. You can't stop and window shop.
Right. Or go to the food court.
But there's all kinds of places you can do this. You can walk. If the weather's crummy, you can walk on a treadmill. You can go to the mall and walk around.
And a couple of my primary care patients that come in and say, "Can you write me a script for Silver Snickers?" So that's with the YMCA. We write them a script, and then they have a little exercise program over there. I love aqua therapy because it takes a lot of pressure off of all the joints. They don't feel worse afterwards. They actually feel better. It helps with strength and endurance. But it's so wonderful. Water is so much better than land, because if you have arthritis, you might can aggravate the arthritis and make it worse. Oh my God! So
a lot of the patients that I have that are elderly do have problems. Have knee replacements. They have arthritis. So that's an excuse not to exercise. But water aerobics is really the way to go.
So my mother just been diagnosed after she had a really major. She had a surgery. She developed blood clots. They went to her lungs. She developed a lot of fluid. She went into CHF, congestive heart failure. So a lot of people don't understand, or heart failure. They don't understand that terminology and what's going on. And they really don't understand the importance of weighing themselves every day and calling that provider if they gain 2 to 3 pounds in 24 hours. Can you tell them what's the difference in hypertension and heart failure?
Well, hypertension is just high blood pressure. And if it's very, very high and not controlled, it can lead to heart failure. Heart failure, you'll hear somebody come in and say, I went to the emergency room and they told me I had fluid around my heart. It's really not fluid around the heart, it's fluid in the lungs. There's multiple potential causes for that. You can have a weak heart that just can't pump the blood out and it backs up into the lungs. You can have high blood pressure, which is making it hard for the heart to relax, and you can have diastolic heart failure. But basically what happens is the little airways in the heart have little, very, very small capillaries, and the fluid and the blood circulates through that. And the air in the little airways, it's kind of like a sponge, the oxygen will cross over into the small blood vessels and oxygenate them. If the pressure goes up or the heart's weak, the fluid in those little capillaries go into the air spaces. They fill them up with water or plasma, and that's what heart failure is. You obviously can't breathe. You're short of breath. The treatment then is, usually you'll have weight gain, like you say, because the patient has been building up with fluid and salt. And the treatment is diuretics and other medications. But I always think of it as a sponge. A sponge has a little airways, And
Yeah.
then if you stick it in the water, the airways become full of fluid. And if the airways are used to carry oxygen, and you put fluid in there, obviously you can't breathe. So that's basically what heart failure is.
Yeah, and what I deal with her, and I do with a lot of my patients, is a couple of the home health agencies, they do have a heart failure program. So then they bring in devices. They give the patient a scale. They give them a graduate, which is like a big old measuring cup. They have a nurse that calls them every day and notice that the weight is up, the blood pressure's up, the heart rate up. So they give them a blood pressure cuff. They give them a pulse oximetry monitor. They'll call them and say, okay, what did you do different? So my mother is new to this, and she told my father to get her some baked fish from Captain D's, right? So she not thinking in her mind, okay, it is baked fish, but it is a fast food restaurant. She got green beans, but of course they put salt in it because a lot of times the restaurants want you to eat the food and want it to taste good.
That sounds good for lunch.
I know, but in a heart failure person, it's not.
No.
Because she ended up gaining 4 pounds. So then, of course, we had to double her diuretic, have her go to the bathroom more to get that fluid off. But she noticed the difference. She understood then after she ate it, it retained that fluid.
Right.
She was like, oh, it makes it hard to breathe. It makes it hard to get up and walk around. I'm more lethargic. My legs feel heavy. And once she went to the bathroom several more times with that extra diuretic water pill, she felt much better. So then that put it in her mind. Because sometimes people got to, hard head makes for soft bottoms. They got to learn the hard way. So she'll know now to never do that and to make more of her fruits and vegetables and to, look at the container, look at the label. I teach my patients. We have labels in each room. Look at the label. If it says the serving size is half and it says the sodium is 1,200, but you eat this whole and it's 2 servings, then that's what? 2,400 milligrams, right? So again, you have to look at your label. You're looking at the serving size and then how much sodium is in there. And then keeping up with your regular schedule appointments with your primary care, with your cardiologist. He's a specialist. He may see you a little bit more than I do, or he may see you a little bit less. Usually your first line is always your primary care. So you go to your primary care, they should be looking at your numbers. You should be asking what your numbers are, your vital signs, each and every time you go in there. So if you don't come to us and you go to somebody else, we want you to be an advocate for yourself. If you notice that the signs are, your vital signs are going up and up, your blood pressure, then you question your provider. Okay, what are we going to do about it? My heart rate is higher and higher. And then, are you having palpitations? That can be sometimes thyroid, sometimes it can be cardiac, sometimes it can be pulmonary with your lungs. But you need to say something. You gotta pay attention to your body.
I think one of the things you mentioned that's so important that people forget about the treatment of hypertension and prevention of heart failure is sodium in food.
Yes.
People don't realize it. Just like you said, I tell my patients the same thing. First thing is before you tell a patient you need this drug or that is how much sodium you're taking in.
Yes.
And people, the maximum amount a day is about 2 grams, or 2,000 milligrams. You don't realize how much salt there is in food. Processed foods, fast foods. You can go get a
sodas.
Soda, and you can go get a hamburger and fries and stuff like that, and probably exceed the 2,000 milligrams of sodium.
Easily.
And the other thing is the food you eat. You can now, thank God, you can look at the cans and it'll say so many grams of sodium, but it may say 2.5 servings on it.
Right.
And it's some of it's common sense. If you have a bowl of chicken noodle soup, and
Which
you,
is
and you
another
take
salt.
it, and you take it, and it's salty, you know you shouldn't be eating it.
Right.
If you eat, I ask my patients, you watch your salt. Oh, I don't salt anything. Well, what do you eat? Well, I'm having country ham,
Right.
and a soup, and I really don't eat anything
Right.
salty.
Because in order to preserve food, they have to put sodium in
Right.
it. If it's on the can, if it's in the can, on the shelf, in a box, anything like that. If it goes in the freezer, they have to put sodium in it.
Right.
Sodium and salt are the same thing. Some people don't know that.
That's right.
They're the same thing. So even if you're not handshaking the salt on there, if you're eating those things and you're not making it fresh yourself,
Right.
and you know how much you put in there, then most likely you're going to have a diet full of salts.
Correct.
And then another thing is like gluten and things like that. All of these things that you're eating that the body does not process leads to the heart having to be overworked, which then leads to the kidneys have to be overworked. That's why we have dialysis center on every corner now, because in the 80s, when they went to the low-fat diet, what did they put in those foods? Salt. What did salt do? Blew everybody up. And that's how obesity really became prevalent. Obesity does not start after 35. It doesn't start at 30. It starts at the BMI, body mass index, of 27. Primary care providers And everybody should really be looking at this BMI of 27 and really starting to talk to your patient. No, you don't want to badger them and say, hey, you're fat. And if you lose weight, you're going to be better. Because nobody's geared to be a 10. It's not about that. We're looking at the reason that BMI is 27. It can be from the salt intake. It can be from the inflammation in the body from the foods that they're eating that they don't process. If we get those things out of the diet, the weight is going to come down. But we're not just looking at the weight per se. We're looking at the fat intake. We're looking at the sodium intake. We're looking at the percentage of fat. That's what really determines on you coming down. Because I know some healthy, thicker people that don't have high blood pressure. And I know some that's really skinny that do have high blood pressure. So that's the media sometimes telling us that if you're fat, you're out of shape, and if you're skinny, you're healthy. That's not correct. I see patients coming here to see you, and they come in all shapes, sizes, and colors. They in different ages. They're young with hypertension that's been uncontrolled. They're older with heart failure because of hypertension being uncontrolled. We have a rainbow because you can never judge a book by its cover. So that's why you have to get to the nitty gritty of talking to your patients just like I do. And we really want to make sure when you leave here, you went to a doctor's office and you learned something. So what do you think about inflammation in the body?
Well, there's two things you mentioned. One was inflammation, and the other was having patients weigh themselves to see if they're retaining fluid. There's definite evidence of inflammation causing being associated with coronary artery disease or blocked arteries. When the arteries develop blockages, it's basically a crack in the lining of the vessel. Cholesterol gets in, then the body has macrophages or white blood cells that gobble it up, and all this junk develops in there, and then calcium gets in there in time, and the whole wall of the heart. This is not lumen like we can rotor-rooter it. It's not grease inside the wall, inside the lumen, it's called, where the blood flows through. It's actually the wall. The wall is a muscle of the blood vessel, and that expands and then eventually causes a narrowing. And so that's an inflammation process. Number one. The other thing, they've done studies on people with gum disease, and if you have gum disease, there's about a 3-time that's inflammation of the gums, 3 times increased incidence of having heart disease or blockages of the heart.
And that was our last show that we had with Dr. Pam Asap. She's a dentist, and that's what she's talking about. Starting oral health care as early as soon as those teeth erupt. Teaching people how to brush their teeth correctly. Teaching people that get older about when you remove the teeth and have dentures, the importance of oral care, because all that goes right to the heart.
It does.
If you had a what is it when they have to take an antibiotic before they have a procedure?
Rheumatic.
Yes.
Right.
Yeah. So whenever they go to the dentist to have like a cavity filling or something like that, they need to have their antibiotics. Sometimes the dentists are right for it, but sometimes they just have to ask their primary care, hey, I'm going in for a dental procedure, and we'll write for like just a day type of prophylactic antibiotics for them, just so that doesn't go into the heart. So it all goes together. The dentist, the primary care, the cardiologist, the pulmonologist, the exercise trainer, the meal prep, or people do a lot of meal prep for you. A lot of people do now meal replacement. They all go together for the good of the person, right? But that person still has to know what each part is doing to them. They have to be their own advocates and come in and talk to the patient. So I'm just like, but I'm so ecstatic that you're here. I'm just like, I cannot say it more and more. You are an independent contractor. I'm an independent contractor. That means that he goes to facilities and we send patients to the different hospitals or whatever, but we are not bound by that facility. So we're able to think outside the box. We're able to bring in different things like different testing, go different ways. We talk about holistic things with patients that may not want to start right away on medications, or how to bring down the inflammation in the body. Like I said, doing food testing to stop the different foods that they're eating. We have that luxury to do that with patients that they can't get when they're with a provider that's with a system. So it's a lot more and more providers that are becoming independent. We try to help each other by sending each other patients, because it's enough for everybody to go around. But you and I have been going together since I opened up. A rep told me about you, and ever since then I sent all my cardiac patients to you. So now you're here in the office at Jarvis County Medical Services. Everybody is just so ecstatic. So if you all want to come in for an appointment with myself or with Dr. Crawl. We take most major insurances. You can call the office at 502-822-3659. It's now going to start saying Jarvis Family Medical Services and Louisville Cardiology. We're at 912 Lily Creek Road, Suite 200 to 201. So at the 912 building, you'll see Jarvis Family Medical Services Primary Care, and you'll see the Louisville Cardiology sign on our buildings. But you come in at one door, all our staff talk to each other, we all know each other, we converse, we make sure that it's as comfortable for you, we try to get you in and out as quickly as possible without compromising your health. So we are just one big happy family, Dr. Crawl.
And I must say that this is probably the happiest, friendliest office I've ever worked in.
All right.
The staff is great.
Yes. So I'll see you all next week on Karla's Corner. Have a wonderful and a blessed day. Bye-bye.
If you like health and wellness, then she's got your message. You came to get it from Karla's Corner. Make the world better, one life at a time. On Karla's Corner.